the center for ocular testing done in the following image. Which is that center which is involved in the ocular testing? What is the ocular testing you are doing? While clinically examining this lady, can you give me the cam? Yeah. Amrita Francis is proposing interstitial nucleus of Kajal. Abbas Aziz is proposing A. What is your answer, Lawrence? PPRF? Amrita Francis Jindabad. So also Roshan Yadav. So it is the interstitial nucleus of Kajal that decides our vertical gaze. Right? Identify the lesion that you are able to see in this fundus picture. Yes. You like to say? Cotton wool spots. Lawrence is our cotton merchant. Right. Any other answer? Quickly. You have to punch the answers quickly. Please tell your classmates, WhatsApp them that the quiz time has started so that they can join the image based quiz every day. Vivek, Gautam, Roshan, Yadav, everyone says cotton merchants both hai. हाँ, मगर मेरे साथियों, why it should be localized only in the optic disc area? If it is cotton wool spot, it won't do like that. So that is the reason you should remember. You should remember. Anybody, one answer. One out of the box guess karo. Shilpa Reddy Jindabad. That's right. Shilpa rightly says. Even Chandrakant also. Drusen. What is drusen? Drusen are those yellow deposits in the retina. And they are made up of lipids and fatty proteins. But one thing you should remember, that there is a condition called age-related macular degeneration. Drusens can predispose to the age-related macular degeneration. That is what you need to remember. Now, doctor, causative organism for the infection in the patient shown in the figure is what? Easy question. Yes. Good to see a significant number of online classmates. Tell your other classmates to join the quiz. Every day we have image based questions, at least some 20 questions we will discuss. Yes. Should your answer, doctor? I want to see 100 students tomorrow. My own students are the best brand ambassadors for me. I don't spend a single rupee on advertising. This itself is an indirect way of our advertising, right? So should your answer, doc? Quickly. Satya is proposing Klebsiella. Ritu also. Ravi also. Absolutely. Ventilator associated pneumonias are all Klebsiella. A 60-year-old patient comes with a history of vomiting for 10 days. Treated with a large volume of the fluids. Develops quadriparesis. MRI is being shown to you. What is your diagnosis? It is also called locked up syndrome. Yes. Should your answer, doctor? Yes. Yes. It is also called locked up syndrome. Yes. What is your answer, Lawrence? Yes. Yeah. Central pontine myelinolysis. Pons is called the center of efferentiation. When hyponatremia is suddenly corrected, you develop the central pontine myelinolysis. 61-year-old woman presented to the emergency with chest pain. ST segment elevation is there, but coronary angiogram showed normal coronary arteries. Left ventriculography has been done. What is your diagnosis? As the future cardiologist, you should give the correct answer. Yes, doc. Should your answer? Yes. Chandrakant Haidar is proposing B. Vivek Gautam also B. Roshan also B. This is called Takotsubo cardiomyopathy. Kabhi suna kya, Lawrence? Nahi suna? Haan. So you have a lot of general medicine, 15 days, 15 into 6, 5, 75 hours is waiting in the 120-day program for you to do the revision. All these things are discussed, right? So Rekha, everyone is saying Takotsubo. There is a hypokinetic mid and apical segment. Japan mein this pot is called as Takotsubo. So they are the ones who discovered on the angiography Takotsubo cardiomyopathy. Coronaries are normal, but you get heart attack. Now, a patient with the below chest radiograph has infertility. The most likely underlying cause for the infertility kya ho sakta hai? Yes. Shoot your answer, doctor. Yes. One strong answer. Infertility. What is the most likely this infertility is because of? Is due to what? Yes. Sumera Neha, Chandrakant Haidar, Suhani Patak, everyone is proposing astenospermia. You are able to see situs inversus. Situs inversus infertility means Carter-Jenner. Carter-Jenner mein ciliary dyskinesia is making the sperm swim slowly, right? So that is astenospermia. A middle-aged woman complains of tingling and numbness in her hand. And her examination, she has a glutathione reductase activity decreased, and also her oral and tongue features are being shown. Which vitamin? You like to say B12? B12 is Lawrence answer. Question number 6. Should your answer, doctor? Yes. So Priyanka Jindal is proposing B, vitamin B1, thiamine. Sai Pavan thinks vitamin B12 like you. Don't worry, you have some friends. Samira Neha, Jindavad. Vishalakshi also is right. It is folate. You have angular cheilitis, fissured tongue, glutathione reductase activity is folate dependent. That is what you need to remember. Glutathione reductase activity. Now here you have drug A, drug B, drug C, all of them are used in rheumatoid arthritis. All the 3 drugs are used in rheumatoid arthritis. So based on this description, drug B, which is labeled here, which is that drug B? Based on the mechanism of action depicted to you. Yes. Yes, doctor. Should your answer? Raju, water bottle. So, give me one confident answer, doctor. Yes. Vivek Gautam, Priyanka Jindal are proposing etanercept. आपका क्या राय है? Shilpa is also proposing etanercept. Oh, no. It is not A. It is not A. It is etanercept. Correct answer is C. Correct. Etanercept Golimumab, adalimumab, infliximab, they all inhibit the TNF pathway. Rituximab acts on CD20 and it is the elimination of the B cells by antibody and complement mediated cytotoxicity and by apoptosis. Rituximab functions. Anakinra is an antagonist on the interleukin 1 receptor. It blocks interleukin 1 alpha. So that is what you have to be sure. Very good. Now this ECG pattern देख के आप बताना है what is the arrhythmia that is being depicted on this ECG. Yes. Give me one confident answer, doctor. So please click on the bell sign so that you get subscribed with the notifications on the youtube.com/onlinembbs channel so that you get the notifications. Also tell your classmates also to subscribe to this YouTube channel. Yeah. If you click on the bell sign. Yes. So Sudha Shukla is proposing atrial fibrillation. Sara Kadari, Rituraj Jindabad, multifocal atrial tachycardia. देखो अगर आप P wave को देखें तो different appearances of the P. कभी P notched है, कभी P inverted है, कभी P tall है. Right? So that is the point you need to multifocal atrial tachycardia. So there will be discrete P waves with at least 3 different morphologies. And atrial rate is more than 100 beats per minute. So that is a point. And PP, PR, RR intervals, they are all varying. Multifocal atrial tachycardia. Very good. Sai Pavan says, no worries sir, kal tak aapko 100 students आएगा. I will tell all my classmates on the Facebook and WhatsApp, Telegram. आजकल तो प्रिपरेशन तो मजे में कर सकते, फ्री में कर सकते. That is the beauty part, but at the same time free is toxic. So you should have organized freedom. That is where you need to join a 120 days package along with online tests. Elderly female, she has a pain in small joint, sparing of distal interphalangeal joint, and her X-ray is being shown. What is your diagnosis, doctor? X-ray is being shown. I mean, too many clues are given actually. That many clues nahi dena, either X-ray dena, nahi to clinical story bolna. Aizaz Ahmad Wani is proposing rheumatoid arthritis, so also Chandrakant. Dekho bhai, this is the joint. Periarticular osteoporosis. Can you see the lucency around the joint? That's called periarticular osteoporosis. Is the radiological hallmark of rheumatoid arthritis, right? So that is the important clue for you. Now doc, there is a periarticular osteopenia with marginal erosions in the MCP and PIP joint with the sparing of the DIP is the classical feature of rheumatoid arthritis. Iska answer bolo. You asked the patient to have a left gauge. Then you got this. Now tell me, where is the lesion? Where is the lesion? Question number 11. Let examiner ask me to become the MCQ setter. I can give the best image based questions, but I don't take that position because I am also a teacher, no? So a lot of times I got the opportunity to become a paper setter, but I said no, because when I am a teacher, ethically I should not be the paper setter. आप paper set करो, मैं बोलता हूँ students को तैयार करता हूँ like an American sniper to shoot against you, right? हाँ. अभी बोलो डॉक्टर, Amrita Francis is betting on D, right medial longitudinal fasciculus. Sara Kadari is saying left MLF. बाबूजी, आपका आंसर क्या है? Roshan is saying sixth nerve palsy. Sixth nerve palsy है तो कहाँ की sixth nerve palsy? Sixth nerve palsy है तो medial position में when looking straight it should come to the medial, but it's not medial, right? So ultimate winner is Amrita Francis Jindabad. Excellent, excellent, right? So it is a right medial longitudinal fasciculus. The eye which has a adductor lag, उनके side में MLF is having a lesion in internuclear ophthalmoplegia. You are asking to look left, so immediately your left eye abducted. But that information should be told to right eye. Who has to tell? There is a path which is connecting the abducens to the oculomotor. Left abducens is connected to the right oculomotor, and once left eye is abducting, the right eye is being informed that the left eye is abducting. So you adduct बोल के बोलना है. So the oculomotor of the right eye then will adduct the right eye. But if the right MLF is abnormal, then your right eye will not be able to adduct. So it remains in the median position, and your left eye already moved to left, abducted. So you get diplopia. To correct that, immediately your abducting eye will come into nystagmus. Immediately it will come to the median position. So there is a nystagmus in the abducting eye and the adductor lag, and the side where the adductor lag is there, that is the side medial longitudinal fasciculus is abnormal, is what you have to remember. Now the triad of skin lesions, clinical features of triad of the skin lesions that you are seeing, a rash, asymmetric mononeuritis multiplex, eosinophilia, and the biopsy is showing this kind of eosinophilic infiltration. आप देख लिया ना? What is the diagnosis is the question. What is the diagnosis? Raju, another 8 questions. फटाफट खत्म करेंगे. So what is quick answer? Satya Snigdha is proposing Churg straws. Absolutely right. Right? Absolutely right. Fluorescein angiography is being shown in this patient. He is also having neuropathy and ataxia. So how is this condition is transmitted? What is this condition and how is it transmitted? It's a very, very important question. 70 online students, हम बहुत खुश हैं. Yes. What is your answer, doctor? Please mention the question number and punch your answer. Fluorescein angiography is showing, what is this? Shall I tell one clue? It is a bony spicule appearance. Vareva, Rituraj, Sheikh, Munni, absolutely right. It is retinitis pigmentosa. It's called NARP syndrome. N for neuropathy, A for ataxia, R for retinitis pigmentosa, which is a mitochondrially inherited disorder. I am very happy. Even Sudha Shukla, Sai Pavan, everyone did right. So neuropathy, ataxia, retinitis pigmentosa, NARP is a maternally inherited leak syndrome. This is the bony spicule appearance of retinitis pigmentosa. A 4-year-old kid suddenly swallowed a small button battery while playing at home. X-ray was done. What is the next appropriate step you want to do? आप X-ray देख लिया ना? Do you want to do emergency endoscopy, open laparotomy, assure the parents and wait for 5 days, prescribe emetics and induce vomiting? What do you want to do with the button battery? Lawrence is a practical doctor. Sometimes working brings a lot of advantages while you are taking entrance exam. Sudha, Satya, Suhani, Gaurav, Raghav, all are clean bowled. They all thought of emergency endoscopy. Patient मिल गया. एंडोस्कोपी करे तो कम से कम 5-6,000 आएगा, हाँ? Right? नहीं, जरूरत नहीं है. So we have Yuvashri who is proposing assure the parents and wait for 5 days. A 40-year-old male with an ulcer in the right lateral aspect of anterior 2/3 of the tongue. The lesion was 2.5 to 3.5. The tongue mobility was intact. No palpable cervical lymphadenopathy. Biopsy is showing this lesion. What is the TNM classification? At least one student answers, we will go forward. Stage 2, but TNM classification. Satya is proposing C, T2 N0 M0 stage 2. It is T3 N0 M0 stage 4A. So T3 is more than 4 centimeters. But it is 2.5 to 3.5, no? 2.5 to 3.5 means it should be T2, right? And N0 means no clinical positive lymph node. No palpable cervical lymph node. It should be stage 2, actually C should be the correct answer. Now the following need to be transfused within how much time? Huh? Within 6 hours? You need to finish within 4 hours. It is packed RBC, right? Huh. Now, in this patient, first what is your diagnosis and what is the next best step in managing this infant? Based on the abdominal radiograph, what is your answer? Give a quick answer, doctor. Question number 17. Yes. Satya Snigdha is proposing B. Yuvashri is proposing D. Yes. And Sudha Shukla is proposing B. Okay. Chandrakant also. Doc, whether you are a subscribed student or not, don't forget to visit onlinembbs.com and do a login registration. So that if you made a login, then you are there in my network, so that I can send you regularly some emails we can send you, right? Huh. So, doctor, it is a question of ileal atresia, which is a distal small intestinal atresia. So, distal small intestinal atresia may sometimes gastrographin follow through if you do. It can even relieve the obstruction. So, that it is both diagnostic and therapeutic. That's the reason gastrographin follow through is considered to be the best way to treat. Now, what is this technique used? What is the purpose of this technique used in breast cancer? So, first you should know what is this technique and why it is used. Yes. Quick answer, doctor. 2 more questions. Satya Snigdha is proposing for the sentinel lymph node biopsy. Shilpa Reddy also. Raghav Thakur also. Absolutely. Methylene blue dye technique it is called for the sentinel lymph node biopsy. A 40-year-old met a road traffic accident and heart rate was 160, BP was 100/60, elevated JVP, X-ray chest is being shown to you. So, what is the most possible diagnosis? Most possible diagnosis. Yeah. Huh? You like to say pneumothorax? Absolutely. There are no bronchovascular markings and the mediastinum is shifted away. Hence, it is a case of tension pneumothorax is what you have to. Sayeda Ummi Hani is proposing cardiac tamponade because of the elevated JVP. But heart is not globular, no, Dr. Sayeda. Right? Good guess. Right. So, that is the story, doctor. So, thanks for a patient listening and active participation. I hope you have a lot of energy now. Go back to the onlinembbs.com 120 day, 600 hours. according to schedule, subscribe to it and revise the videos, take the daily test, and tomorrow once more at 6 o'clock let us all catch up and continue our revision. Thank you for coming.